Hi, I'm Carissa. I'm going to do a basic IV catheter insertion. First thing I would do is verify my doctor's orders that I have an order for a catheter, and then I would verify the patient and make sure that their armband matches and everything is good there. Everything is all clear, so I'm going to go ahead and do my hand hygiene. Then I'm going to go ahead and I'm going to attach my syringe here, and I'm going to drop 3 milliliters of air. Flush. Sharps container. I'd get my tubing ready. And prime my tubing. And then positive pressure, and I would clamp it shut. Just going to leave that all set up and ready to go. I would then apply my clean gloves. And then I would apply my tourniquet. Palpate my where I'm gonna go. Clean it off. Just going to prep my dressing here. I'm going to go ahead and write the date, my initials, the time, the length, and the catheter size on here. So that's ready to go. Looks like that's dry now, so I'm going to go ahead. I'm going to pull the skin taut. Insert.
Now I will be putting on my gloves.
Oh, looks like I'm going to have to go again.
And I have to lubricate the end of my tubing and ask my client to bring his head backwards. And as I insert my tubing, I will check for any coiling. I don't have any coiling going on there. And ask my patient to swallow. Just swallow for me.
I see a blood return.
Advance my tubing. If the patient swallows,
So I would put that in a sharps box and connect my tubing. I would then grab my tape here and just secure this. Then I would open this here and do a push stop flush. After I would aspirate. And positive pressure, I would go ahead and clamp it off. Get some alcohol here. Cleaner on the site.
And it looks reddish brown, not as thick.
I'll apply my dressing only on the catheter part, not on the connecting tube. Disconnect my flush then. And then I would go ahead and document in my MAR the name of the patient, the date, the time, the catheter length, the gauge, and my initials. And then how it was tolerated, that there was no infusion or redness or irritation, and there were 2 attempts. And then that would conclude my IV insertion. And then I would move on to my IV medications. First I was going to go ahead and do my piggyback, or my sodium chloride. I checked my MOR, my doctor's orders, and he had ordered some saline strips, so I'm going to go ahead and hang that. There's 250 milliliters. So now that my MOR's been checked, I would do hand hygiene and apply clean gloves. And then I would get my bag ready. I'd put a label on my bag, the patient's name, the date, the time, and all of that information. I would have discarded that. Then I would go ahead and get my flush ready. Eventually. I'll draw it. I've got my sharps box. That'll leave that. Then I would go ahead and get my alcohol swabs, and I would connect my tubing. I'll go ahead and prime my tubing. Everything was open. Prime it until there were no air bubbles. And I gather my MAR, take all my supplies in with me. Once I'm in the patient's room, I would hang the bag. And I'll go ahead and clean off this. I'd aspirate, and then I'd do a flush.